doing. He is, they took him for medication over objection, so he is on medication, but he is not close to restoration, so for being restored. So this money would get us through the end of the year. Obviously, if he is returned sooner, the money would get spent on him. Rochester Psychiatric, they tried and have a wait list for it for people being restored, so it isn't like they're just lingering there. They do work on restoration and getting them returned to the community as soon as possible. And then we do know that Judge Mullen has said that as soon as he's returned to our jail, they would get him in for court. So he doesn't
Good news all.
I hate to, but yeah, we got no choice.
And I thought we were,
No,
this is a case we've been fighting.
No.
This is
No,
not,
this is,
that's what I
so,
thought.
yeah, 730s are definitely within the law. It states that counties are responsible. It used to be 50% our responsibility, but then a couple of years ago, they changed it to be 100% county, on the county. I know it is an issue that NISAC is definitely interested in working with our accountants and local hygiene directors on. The one that there was 508, which is a sentence to me and go to a psychiatric center for treatment. That is the one that has the gray area within the law. That our interpretation is that we should not have to pay for it, but OMH says we should. So we did have 2 individuals that went last year, and our stance is that we are paying it. OMH says that we need it, so that's what that is at right now.
Members of the public knew about all these fees that we had to pay. We discussed it with the 13. Tremendous amount for the taxpayers. State doesn't pay that. Okay, I got a motion from Supervisor, correct? Reluctantly.
yes.
Who put that in there? All in favor?
Aye.
Opposed? Item 4, FYI.
So we did have a second 730 request ordered. This one has a little bit, I guess, of a silver lining that it was an incident that happened at Attica. So this is one that we can get reimbursed for from the state, and we had mechanism to do that. So the individual, it occurred at Attica. He has since been transferred to Marcy Correctional Facility. So I've been in contact with the county, it's Oneida County, sent hired 2 of their doctors to go in to complete the examination, because you have 2 doctors to examine the individual to determine competency. And so these 2 contracts are just to pay for them, the 2 doctors to go in to examine him. They already attempted one time and he refused to meet with them. They're going to go back tomorrow to attempt that examination, and then whether, if they determine, I don't know what happens, because this is a new situation for me, that if he is determined not competent, I don't know where he goes, because he's already in a correctional facility. I don't know if he goes to Rochester Psychiatric or what happens with that.
Who pays $1,000 a day if he goes there?
I think it would be, the county would be responsible, but we have a mechanism to get reimbursed from the state for that, because
It was
he's in, because he was in the criminal justice system already. So.
Okay. Anything else? Any other good news for us?
No, I just followed up from last month that on the methadone piece, I have not received any new information other than it is indeed Community Action of Erie County. I reached out to them twice for information on what they proposed, and they've only acknowledged that they did receive the funding, but they have not shared any information as to what that proposal will look like. And Community Action here in Wyoming County doesn't have any information yet. So when I know more, I will share that.
Board meeting Thursday night. And you got, Joe? Okay, Laura.
Good morning, everyone. Good morning. Gee, poor Kelly, you got better reception. Okay, item number one is the New York State Department of Health 3-year grant for the rabies prevention program. We've not seen any movement in the annual amounts of funding, so this is as expected. The work plan deliverables are so this supports our rabies, animal anti-rabies vaccination clinics by the year. And it also, in a very small way, helps to defray any rabies post-exposure expenses that we have.
There was an article in the paper where somebody in Attica had a pet raccoon.
Oh, yes.
And then they had to euthanize it in order to check the rabies.
We know about this. Rob, did you want to elaborate at all?
Sure, we got a very frightening call from Erie County. This person brought a raccoon into a pet store in Erie County on his shoulder. Was purchasing supplies. They contacted us, contacted DEC, DEC got involved. Yes, DEC law, the Department of Wildlife. The comment from the gentleman was, I grew up in the country and this is just what we do. That's maybe true, but anyhow, DEC went and I thought it meant that they threatened the ticket unless he gave up the raccoon. Evidently, they gave him a ticket and the raccoon. So they did not say they didn't have negative reviews. Yeah, it's one of those education pieces that we try to deal with to let people know that if there are wild animals, just
So why did they even have to test it though?
because of the contact with people. There's an exposure, you don't know if it's rabies or not, if it's passed it on. So,
I guess I wouldn't have tested it. I would just taken it back to the woods.
yeah, but if it did have rabies and was able to pass it on, you know, now you're dealing with, if you got a rabies case and
They don't.
then it was sent out.
It was, Erie County was really worked up on this. And, you know, I actually had the same question was, where is the exposure? Do we ever confirmed bite or scratch or
Right.
wound? And we didn't get that involved in it, but we heard about it. That's right.
My wife had a Facebook post from this girl that lives in Perry, and she was in Georgia, and had a picture of a guy, he had a therapy squirrel on a leash.
I wonder if anything went wrong.
No nuts allowed.
I can't even say what I'm thinking. Any questions on that?
Yeah.
I moved here today.
Gotta be home today. That's it. Okay.
That motion?
Yes, I would.
I'll make that.
I think Supervisor King makes a motion to accept the Montgomery State on paper.
Aye.
All. Okay.
So, this is the third time back for this one. The original resolution was presented by Real Property to do some contracting for the GIS project that's underway. Jeff was able to secure approval from the Fellows Ranch to offset a portion of the training on that. So it came back around recently, and what's happened subsequently to then, there was a lot of detail in the last resolution, the classes, the cost, and since then, there's been a recommended change to the coursework, and it's replacing one course for a different one at a lower cost. So my recommendation is just to remove the detail on this resolution, kind of restoring it to the one we had a couple of months ago. It's just so we can get the coursework paid for and make sure that there's a little bit of flexibility going forward in the event that we have a recommendation for different classes as opposed to the ones on the list.
I think the goal the last time it got split was to make sure that public health had.
Yeah, which is perfect. That's perfect. That's a big help for us to get reimbursement for that $6,000 in training expense. what happened unfortunately was the 4 classes were listed very specifically, and as soon as we had a change, we got stuck. So it's just removing the detail, there's no change in cost or split between public health and real property. Third time's charm.
Motion,
I'll make it.
Supervisor May. Very further discussion. All in favor? Opposed? Okay. Item 3. Fire department.
So, Jess, if you would chime in on this, this year is part of the 22 budget adopted in Albany. Local health departments we're fortunate to have an increase in our base state aid to the extent of $100,000 a year. And because it began April 1, this year's increase is 75,000. So we were talking, the very first thing we need to do is get that money into our budget. And the next question becomes, how will it be spent? And so, if you recall, this is going back a little ways, the planning committee, I think, came through and did a tour of county buildings and took a look at stopped out at the health department, took a look at the space we were using. And a couple of things rose. One, we have stuff stored everywhere just because of the course of the last 2 years. And secondly, we have no kitchen or eating area for employees, causing them to eat at their desks. And so the renovations down at the other end of the building occurred. Veterans has since moved. Tony Salinas seems very pleased with the space, so I'm glad for that. And now I find that, in talking with Mike Adams, we could use some renovations. And I'd like this committee to consider allowing us to use the increase in state aid for this year to undertake some building renovations, physical plan. Prior to the events of last Friday, we had already been discussing the lack of security down at the health department. We have no electronic locks, no cameras, no panic buttons, and we're down in the sunny south, we're outside of town. And so we've had some incidents that have been documented internally, a couple that we reached out to the sheriff's department to talk through. I think this is absolutely the right time for us to undertake those security improvements. Thirdly, the parking lot has grass growing up out of it, so Devin and Pete from Highway stopped down yesterday to take a look. It's my request that we be permitted to utilize some of the increase in state aid this year to pay for building enhancements.
So this should be referred to public works, not planning. So I don't think there's any space allocation plan, they're just renovations.
Yeah.
Okay.
Item 4 goes with this.
Yeah. 3 and 4.
I think those numbers are missing a zero. Yes.
Oh,
Numbers are on.
That's probably, I think they probably.
Like this previously, they may change a little bit.
They are, yes, absolutely, and
I emailed that to you.
Okay.
Just so you have it.
Okay.
You have it.
I'll look for it.
similarly with the security in the parking lot, when we were speaking with Devin and Pete yesterday, there always are 2 options with the parking lot. One is the big bad renovation, right, in our budget, and the other is, some milling and patching and whatever, sealing and striping. And so they're gonna produce those estimates, those will be carried back, just so you all understand what the options are. I'm leaning towards, the more cost-effective solution, just so we can be judicious with the funds we have and get those interior renovations. Similarly with buildings and grounds, we've been talking about security off and on for 4 or 5 years and just can't seem to get across the finish line with it. So I just ballparked the 10,000. I don't really know the cost of that, so all of these numbers are subject to movement. But in any case, we're certainly not seeking to exceed the funds that we have.
If you don't have any cameras or anything up there, so that might be, reach out to Bill.
I would say it's an IT deal.
So there's it's a little complicated on the security portion because it's IT related, but but it's also buildings and grounds, like, so there's some pieces there, so, you know, again, these are estimates, we'll just see. In
Because right now,
order.
Bill is working with, he's looking at other cameras and security and stuff, so.
But they work together, Bill and Mike do all that stuff together anyway.
So here's the kicker, this work needs to be completed in 2022. So,
For the phone.
yes, so I'm gonna put a project name together.
There you go.
Has to be done.
It has to be.
Even though the state pointed your.
Well, so this is the 75,000 that falls in 2022, right? So in 2023, when Jessica gets to work on preparing the county's budget, we'll budget for an additional 100,000 in state aid. This year, we didn't know what was coming, the funds are not in our budget, but in order to be claimed to state aid, we need to appropriate that. For the rest of our salary lines, Jess was able to confirm, looking pretty good. We continue to bill for COVID vaccine administration, which has resulted in some revenue that was not budgeted. And we've also carried a vacant position that was budgeted for. So given budgeting in the health department's become kind of tricky business, but again, the goal is to use the grant dollars that the state provides to us in a way that supports the goals in the county. And just
This estimates are low. Is there any way you can use those funds you just spoke about to subsidize it?
Janice is not in our head. I hope that's not the case.
Be creative some way.
We do have some opportunity for maybe some of the security to fall under a couple of our grants as well, if those costs are low. So there is some wiggle room.
Thank you, I forgot about that.
Fine. Is there any other discussion on, obviously, the security issue of the county? I have a motion by Supervisor Kozlowski. Is there any? Hearing none. All in favor? Aye. I'll call. Great.
We had a big meeting.
So number 5, I'll do the first one is now the Bureau of the Health Department had a grant with OCFS, the Office of Children and Family Services, a new one for us. And we partnered with the Youth Bureau, and they're assisting us with distributing the educational materials and whatnot to their EI population. And so I think we went through and thought this many distributions of this much additional time. This is an MOU between the departments.
I gotta tell you, I almost called Channel 4 this morning
Why?
because they were advertising that you could only take advantage of these baby bundles if you lived in Niagara County. And I'm screaming at them, like doing my hair and stuff, that's not true. But I didn't have time to call my son, that's okay, the right story.
So, but thank you for giving us. So interestingly, this was a relatively new nurse at the health department identified the opportunity, came and talked about it, wrote it, and was awarded. And so I give her, some kudos for that. That's an acquired skill, and she did a good job. It's not a big grant, but it's a nice role into maternal child health. And the third one is, I'm skipping over number 2 for the moment. The third one is related to the closure of the health department's family planning clinic at the end of last year. One of the requirements of every local health department in New York State is to provide STD testing and treatment to anyone who needs it, regardless of insurance status. Now, in Wyoming County, our uninsured number is pretty small, and the supply of primary care is pretty strong right now. We've not really had any door knocks on this particular service since the first of the year, but we need to get our house in order to make sure that service is available for people who like to take advantage of it. This is an MOU with the health system to run our labs. So this is state aid required, New York State Department of Health required state aid eligible expense. I anticipate funding very low. And the item in the middle. So we were brainstorming and COVID ran grants that the health department has received over the last couple of years are very narrow in some of the work plan allowable activities. And so we were talking about, and we brought it up with this committee last month regarding incentives. How do you feel, what do you think? And I think it was Supervisor Roach that said, spend the money on infrastructure items first, see what's left, and then go from there. And so we were in a meeting 2 weeks ago, I think 10 days ago, and started talking about the fair. The health department maintains a booth there, and started talking about the economics of today and how families are under a lot of pressure, and a trip to the fair with a family and the big kids might not be as affordable as it used to be. And we had a suggestion, what about ride bans for incentive for COVID vaccine for the pediatric population from Wyoming County residents only? We think this is a great idea. We'd like to promote Wyoming County, support the fair and the Pike Fire Department. So put on our detective hats, Jess has reached out to 2 of the grant streams to see if it's an eligible expense. One has declined. Have you heard of the matter yet? So, because of the purchasing protocol, right, it really needed to come to this meeting today for at least permission philosophically to proceed with purchasing ride vans provided the expense is eligible under the COVID grant. The ride vans are $25 this year, and I spoke with Lynn from Emerald Amusements, and she indicated it would be a direct purchase to them, so they would be the vendor. This was yesterday, I learned this. And the Pike Fire Department would still receive a portion of the proceeds for the purchase. So, this one, although it's an FYI, and it's pretty low threshold item, I didn't want to get the background and open it up for any discussion or concerns that you may have.
Are they good any day or just certain days?
Any day.
So the nurses at the table will be, I mean, how will we find out?
Okay, so this is a great question. We will not be vaccinating at the fair. Nothing about that works for me.
Yeah.
They're just not. So it will be the 2-ish weeks leading up to the fair. We would promote that pediatric vaccination and both Moderna and Pfizer are now, Pfizer's approved for 16 and under, Moderna 18 and under. We're running 2 peds clinics this week, they're filming. So it would be vaccination of the health department must demonstrate Wyoming County residency. Any vaccine in the pediatric series, here's your box. So that's what we're proposing, not vaccinating.
I think it's a great idea. It's a win-win.
Provided the CDVAX grant, people say yes, I agree. It's something that we're kind of excited about.
We do need to update it to its amount. Originally, we budgeted for less payments.
But now they're $25.
Right. We had originally budgeted for.
Oh, is that a math thing again for me, Jess?
25.
It's an expensive day for the fair.
Yeah.
That's
And you had several kids,
I had considered.
and then if they want to do anything else, get a milkshake or.
So
3,125,
it can't be that high, it's over 3,000.
so we could knock that down.
Right, well, it says up to 125 right all day, so I think it's a goal of bringing under 2,500 and however we can, I think that would be all right. Okay. Any discussion or concerns? This purchase will only be made if CVAX agrees to the reimbursement. That's not it.
Just kind of looking for. If anybody's. Item 7.
6 and 7 go together. The grants that the health department received for COVID response, there's 3. CVAX, ELC, and ELC schools. When we originally requested permission to apply and accept those funds, we created positions that would support COVID response inside the health department. Since then, the dust has settled a little bit, and we've got positions on Schedule G that are now funded through 2024. So 6 and 7 go together. This is just amending Schedule G to extend the end dates. Oh, this is the school one that was actually just extended for another year.
Okay.
Also, any kind of goes with the
So, yes, I have one extra. 8 is actually the one that I was speaking on. That's the end date change for the ELC and CB ones.
So 8, 9.
8, 9 go together also.
6 and 7.
Let's do 6 and 7, 8 and 9 all together. And I have a motion by Supervisor Brick for all.
All of them, yeah, they'll put together, that's fine.
Any discussion on? All in favor? Aye. Opposed? Carried. Father's position at the park.
Yeah, so, when I got back in the seat and started to work through the field it occurred to me how grateful and I am for the support of this committee and the board during the time of COVID response, helping us to create some positions that, we really need. These are positions that are sitting frankly in the health department with no intention to refill. This is a housekeeping thing. I don't like to have a ton of positions attached to the department. I think it's important to communicate with the board if we need something, talk about it. We're not, we don't need it.
I have a motion by Supervisor May. Who's that? All in favor? Oh. Okay. Terminal update.
So COVID response update, we continue to test and vaccinate at the health department. Volumes have been low, although now we have pediatric vaccine in the house and there's more interest from some parents in taking advantage of those. So I think the clinics for this week are full. They're close.
I heard 19 the other day, but it sounds like a lot before we count it.
It is true, but we are one of the first outlets in the region to have the pediatric vaccine. We talked about whether or not to limit access to Wyoming County, and very frankly, we've got capacity and we've got nurses that are very good with the pediatric population, and we might as well keep them busy, is my feeling. So that is correct, not a lot of Wyoming County participation. But we also found the same thing early in the adult vaccination campaign that we have people from the Bronx coming in. Other than that, the prevalence of illness in the community, I think, is coming down over what it had been. And testing is low volume right now, but it does remain available for those who need it. We also have mountains of at-home test kits for distribution. The other thing that I wanted to bring up, so we're now the two-dose series, booster 1, and now there's eligibility for a second booster. I am hearing chatter that the Pfizer vaccination is being amended for a potential fall booster campaign to more closely match the variants that are currently circulating. This is a lot like what happens with the annual flu vaccine. They take a look at what's occurring in the southern hemisphere and then they produce a vaccine for when it makes it way, this way 6 or 8 months later. So I think this is all part of the transition to endemic status, and so that's kind of where we are.
So should we get a third shot?
So I had the first 2 in the series. I had a first booster and I'm waiting myself. I had Moderna also, but I'm waiting.
That's what I'm waiting. See what happens in the fall. I mean, they may combine it with flu shot for all we know.
Right.
It's like my father, who's 92, his cardiologist said, don't get it. So.
Right.
He said, he didn't really need it, it just.
And it does create increased immunity, but at this point, I think a lot of people in the community have had one of the variants. And so you create some natural immunity there. This is the season when there is not a whole lot of close indoors time. You know, when those are open, people are outside and the prevalence is dropping. So I personally elected to wait and see what the fall brings, because I don't doubt for a second that we're gonna be back in it as well. So, sorry. Sorry. Any questions? Last month, we came to the committee and let you know that we had a new minor for our ATUBA program, that's adolescent tobacco use prevention. And good job, Benny, 28 inspections, no sales. So that's good compliance in facilities. And coming soon to the HR director's desk later today is a request for the compensation committee to take a look at the coroner's salaries. They are currently paid $100 per case, no flat rate salary for the year. It's all case and volume driven. I like that model because we have a situation where out of 4 of them, 1 of them does many cases and the other 3, not so many. But it's $100 per case, and on average, those cases are taken, even if we take Jen Cressman's ROA off the table because it's high, they're still taking 5 or 6 hours per case. And so that rate is a little uncomfortable. It changed a number of years ago from $75 to $100, but the salary study for surrounding counties, there's some disparity there. So that will be with the compensation committee's consideration.
Is that in your submission, the comparisons, the other companies?
Well, and so what kind of rose this, if you recall a little while ago, Livingston County had approached us wanting a cooperative agreement for coroner coverage. Yeah, those coroners make $275 a case. And so you can guess what kind of, discussion that led to at the coroner meeting in April. And it's, okay. So that would be submitted, just so you're aware. Rob, what's new in environmental health?
Well, you shared the good news about the 2 inspections. We will be doing more of those for our rechecks of facilities that previously sold. So that'll be happening probably in the next few months. But other than that, we spoke about the rabies case here the other day. Yeah, sold a lot under.
Sorry.
Yeah, other than that, we're gearing up. Children's camps are starting next week. We did do a distribution for COVID-19 animal test kits to our children's camps. Anybody wanted?
Did they take advantage?
Some, like, we did many we thought maybe would, but Brian Myers is a little disappointed at the number of kids we were able to ship out the door, but we did share those other camps, so they're equipped. Inspections here. Sure, we'll wrap it up.
That's a time-consuming program for the health department, the 8 weeks of children's camps. You had provided me a ballpark estimate of like 7,000 children moving through the camp structure. And that's a lot of kiddos, and less, so.
How much less is that than in previous years? I imagine a lot of camps closed down.
We did have a few closed, but we've had some others take their place. So we're overall, we are now, yeah, we're getting more day camps though. Which those crank a lot of kids through the summer. So it's busy. And we're training new staff in the program, so that's going to eat up some staff time for sure. We'll get there.
You want to comment on weights and measures?
Certainly can. We're also training new staff in weights and measures, trying to get some cross training. We've had our state specialists out a few times to work on fuel pump training and the testing procedures there. So again, we're out doing those while the weather's reasonable and you're not freezing your fingers pumping gas and testing. But our other staff under Ryan is doing a great job in the inspections.
And I'd like to highlight that we have talked previously internally to the health department about a single point of failure, right? We would like to avoid having a single person competent in a particular program. So it's to Rob's credit that he's moving that cross training. So,
Lauren, it seems like recently I've been hearing more about overdoses and people passing because of overdoses. Is that on the increase again, or?
yes. And we continue to do Narcan training and distribution. Jillian has been very active in that program. Interesting that you asked, she was doing a one-on-one training, and that was one of the security incidents that I was mentioned previously. So we remain committed to that, but we are changing the way a little bit that we're doing business to make sure that we've got everybody in safe situations every time. So yes, Narcan training is ongoing, and I can give you some figures on that. I don't know.
It just seemed like recently, like my husband come home from work and say so-and-so said so-and-so, you know. It just seems like it's more discussed that more and more people are passing from overdoses right now. And it's like, is this something that's on the rise again?
So I think some of it is fentanyl related. Truthfully, there was a person laying on the sidewalk in town a few days ago. I was like, oh. I think it's fentanyl related, truthfully.
One day I was told of a friend of mine that overdosed and they found that.
I'm sorry.
Does it have an expiration date on Narcan?
It does.
Becky and I went to a thing in NISAC here a couple years ago, and I've been carrying my pickup, so should it be updated?
Yes,
You can get it at the health department.
yes,
They trade in the old one for the.
yes. I might even bring it to you next time you tell me you'll be in town. So, yeah, so that's a good point. Anyone who has been trained, those kits. So you shouldn't avoid using an expired kit if there's nothing else available, but certainly keeping them within expiration is a better choice from a standpoint. And honestly, I actually carry two, because if you have someone who's overdosing and fentanyl involved, sometimes a single dose is not sufficient.
There was a call just recently, the deputy did it 4 times. Brought him back.
That's right. So maybe swinging when he came to, but better be quiet than not. So, if anyone has any groups that you'd like to have the health department assist in doing a training session, we're more than happy to do that. Okay, I think the very last item that I have is, I'm in an argument with Monroe County's medical examiner. We pay them a lot of money to do post-mortem examinations on certain types of cases. And those are the suspected suicides, overdoses, prison cases, motor vehicle accidents, and pediatric cases. Those must go to the medical examiner for a partial autopsy or B&D exam. And they're really slow in getting reports. We've got some cases that are pending now for over 2 years. And what that means is we've got Wyoming County family members calling the health department, wanting to know the cost of the electrical bubble. And I've leaned on Monroe County as hard as I can. And, you know, I started uttering the word breach of contract to them because we pay them no matter what, but we're not getting the timely results that are expected and deserved by the families. So trying to cook up some alternative, we'd still have to do business with them. And, you know, in their defense, they're very nice and capable people there, but they've suffered from the same shortage of pathologists that affect almost every industry for employees. So they've onboarded some staff now. I'm hoping the backlog will relieve itself, but if we could do something a little differently to reduce the volume that we're sending there, one, it would be cost savings, because that's just a levy number. And 2, it would be quicker service to the grieving families in the county.
So in other words, the shortage of pathologists.
Correct.
So when you put any pressure on
No,
the legislature.
no, because I actually declined that matter, Supervisor Davis, but I had a really cranky person who said that we were welcome to do business with Erie County if we don't like everything we're doing. So you don't want to make me too mad, because really, it's a complicated system. When the death in the community, the coroner response determines if the case needs to go to Monroe County. The funeral homes are driving them up there. Sometimes they have business, sometimes they don't. So we are deploying a coroner at a cost. We're deploying the funeral directors at an increased cost for 2022, a righteous increase. And, there's just a lot of moving parts, we're paying the lab, and so I don't really want to completely break up with them, I just want them to do the job a little more.
I should talk to George Eber.
Well, in separate our contract, all kinds of trouble. And we'll be at the mercy, frankly, of Erie County, who I hear is, has their own set of challenges to deal with, or Olean, which is like you can't get there. Some parts of the county.
Neighboring counties and there's
I don't know how. So I rose this to nice HO, and we are not eating at all.
possibility of several counties will be together, define one.
So let me elaborate just a little. So one of our coroners is actually, I don't know what her correct title is. She works at First Strong and has been a pathologist, and her career trajectory may be changing. She has expressed willingness to do a certain subset of our cases at our hospitals more. So I've opened the discussion. CEO David Kovis, certainly he's got a lot of things to do. This is why I'm looking at 2030.
That's an understatement.
Yes, I know. To see if there were some opportunity to utilize the morgue of the health system, which I'm told is a very nice morgue. I've not been there myself, but people say it's nice. And she would, I would be. I guess, but well equipped, a relatively clean and fresh, whatever. So we would need to get a per case charge from the health system every time it's used for a Wyoming County case. What's the cost to the hospital for supplies, equipment, and cleaning, right? What's the number? Because the days of, nothing should be done for nothing, right? There needs to be, a righteous reimbursement there. We're already contracting with the lab. And so it becomes a relatively simpler means to have certain cases. Not every case needs a full or a partial autopsy. There is a lesser cost option called a blood and descriptive, which is largely I'm so sorry, you guys, that's getting gross. Fluid samples to determine, that can be used to determine cause and manner. So being able to draw those samples at our local morgue reduces the cost of transport, improves the timeliness of results, and if we can get a number going, I presume it'll be more cost effective than number. Again, we're creating potentially a system with a lot of moving parts, but we'll see. I would be pleased if it yielded some results.
So at that one time, you would be able to take things on autopsies from other counties.
Yeah, it's actually the same.
With the same criteria.
That is, so it depends on how we elect to set the structure, right? So Dr. Putzman, Jenna Putzman, is an elected coroner. In public health law, her responsibility lies in a particular area. This is outside of that. So if she wanted to spin up an LLC and do that, I would rather see, her doing business contractually with other counties and not have it run through the health department, because that is not a state aid eligible activity and there would be a lot of moving parts there. So potentially, but I don't know what her availability or her interest would be in that much business. Maybe.
Just for income for the hospital.
Yeah, be real good.
Okay, well, we're in the talking stage.
Yes, more to come.
More to come.
Please don't say anything to Monroe County, they're gonna break up with us and I don't even know.
No. So now what?
Somebody is. Sorry, are there any other questions?
Democratic. Rob, I didn't see you after this meeting, so like for a second.
Have a good day.
So, okay, anybody got anything else for the health committee? I guess we stand adjourned.
That's my boy.
You got it.
Let's get started.
We'll let you up here, okay?
Okay. I didn't want to be the bad boy. I know I could have, but I didn't want to be the bad boy.
It's such a